I want to help you guys identify and describe the orofacial pain symptoms that are caused by systemic illnesses, identify the pertinent red flags of orofacial pain conditions. We're going to just have you describe the systemic conditions that may contribute to or cause orofacial pain. And then the key thing is how can we form a differential diagnosis for these ominous symptoms? And that's what I want you to really get out of this lecture. I always like to put a little outline here so you can follow along as we kind of proceed through this talk here. All right, so with that, let me highlight a really important case. This was something I grabbed from the literature, but I think it does a nice job to really elucidate the important points of how a routine orofacial pain or TMJ condition can really be something more serious. So here we've got a 47-year-old female. She came to these authors' clinic describing a severe stabbing pain in the right TMJ, along with having clicking. Now, the onset wasn't described, so it's difficult to know when these symptoms started, but she pointed right around the right TMJ and the surrounding area. And then she said, okay, it clicks, and then the authors noted some deviation on opening. There wasn't any prior history of treatment. They did state that the pain increased with movement of the jaw. And, even her medical history was unremarkable. Dental history was pretty unremarkable too. She was partially edentulous and wore an RPD. Interestingly, the authors did find a periapical radiolucency on imaging on number 17. So it was thought, okay, maybe this could be a cause. Let's extract that. Let's make a new partial. And her symptoms kind of improved for a little bit. And then she, went away for a while, returned 6 months later with the same kind of pain. And at that time, she'd undergone a variety of different medical evaluations like ENT, ophthalmologic, CT scans, anything to just see, why do I have pain on this right side? Everything was unremarkable. She even saw a neurologist at one point, was given carbamazepine, didn't really help for long term, saw an oral surgeon, given a TENS unit, temporary relief, etc. So then she comes back 3 months later with persistent pain. And at that time, ultimately, the authors described her as seeing a neurosurgeon who referred her for an MRI. And that MRI, interestingly, showed this intracranial tumor upon biopsy, which was diagnosed as a meningioma. And so after that was removed, the patient was pain-free. They followed up 2 years later, still pain-free, had no problems. And while these situations are, of course, extremely rare, it really highlights the need for us to be more vigilant and see what maybe could the patient have presented with for us to be able to be more suspicious for these red flags. And that's the whole point here. So that's what I really want to review.